Hello Medicos, good day to all of you. So this is Dr. BK for you, and today I am going to discuss about the mediastinum and in detail about the superior mediastinum. So our learning objectives for today's session will be mainly about the definition. So what actually is mediastinum and what is the extent of the mediastinum? So how far it extends. Then about the subdivisions of the mediastinum, and then what are the boundaries and contents of the mediastinum, and finally I will be discussing about two structures, that is the arch of aorta and superior vena cava, which is present in the superior mediastinum. Then finally I will touch upon some applied aspects. Okay, now first of all, what is mediastinum? So it is actually a septum which is present in the midline. Okay, it is actually a septum which is present in the midline or a midway partition which is intervening between the two pleural cavities. So the pleural cavities consist of the pleura, which is investing the lungs. Okay, now what happens is, so the mediastinum on either side is lined by the subdivision of the parietal pleura, which is the mediastinal pleura. Now it extends from the inlet of the thorax above to the diaphragm. So that is the vertical extent of the mediastinum. Okay, it is going to extend from the inlet of the thorax to the lower limit, that is the diaphragm. And from front to behind, the anterior limit is going to be the sternum, and posteriorly it is the thoracic vertebra. Okay, so anteriorly it is limited by the posterior surface of the body of the sternum, and posteriorly by the bodies of the vertebra and the intervening intervertebral discs. Now, so that is what I have been telling. Anterior limit is the sternum. All the three parts of the sternum, your manubrium sternum, body of sternum and the xiphy sternum. Posteriorly, the anterior surface of the bodies of all the thoracic vertebra. Okay, bodies of all the thoracic vertebra, intervening intervertebral discs. So this is, in the lateral view you are able to see the whole of the mediastinum, but for the purpose of description and for our understanding, the mediastinum can be subdivided or is broadly subdivided into superior and inferior mediastinum. Okay, so it is the superior and the inferior mediastinum. So what separates, or what is the demarcating line between the superior and the inferior mediastinum? It is an imaginary plane passing through the sternal angle. Okay, so you know the sternal angle is present at the junction of the manubrium sternum and the body of the sternum, where the second rib articulates. From there you draw a line posteriorly. It will pass through the intervertebral disc between the fourth and the fifth thoracic vertebra, or you can tell lower border of fourth thoracic vertebra. Okay, lower border of the fourth thoracic vertebra. From the sternal angle anteriorly to the lower border of the T4 vertebra is the lower limit of the superior mediastinum, or in other words, it is the imaginary plane which divides the mediastinum into superior and inferior mediastinum. Okay, So that is the limit what I have told you. Now, if you look at the inferior mediastinum, it can again be subdivided into an anterior, middle and posterior mediastinum. Okay, so it is divided into anterior, middle and posterior mediastinum. So your heart with the fibrous pericardium forms the middle mediastinum and occupies majority of the space. So what is present anterior to the fibrous pericardium is the anterior mediastinum, and what is present posterior to the fibrous pericardium is the posterior mediastinum. So anterior, middle and posterior mediastinum, these are all subdivisions of the inferior mediastinum. Okay. Now, at two places, the mediastinum does not contain any important structures. Okay, or you can tell that the mediastinum is completely or almost nil or absent at two places, because at these two places, what happens is the lungs or the pleura comes in close approximation or in close contact with each other. Okay. Now the first place anteriorly you see is at the level of fourth costal cartilage. Okay, this first, second, third, at the level of fourth costal cartilage you are able to see, at the level of fourth costal cartilage, the anterior border of the lungs and the pleura comes in close contact with each other. Okay, so there what happens is the mediastinum is reduced very much, or no important structures are actually present here. While this is the case anteriorly, posteriorly also you have one place at the level of between the T8 and T9 vertebra. Okay, the esophagus passes anterior to the descending thoracic aorta. The esophagus passes in front of the descending thoracic aorta. It is coming anteriorly to pierce the diaphragm. So at this place again posteriorly, what happens is no important structures are present, and the two parts of the pleura comes in close approximation. Okay, so it is at these two places. Now you all know that the mediastinum is actually a place or a partition or which is intervening between the two lungs and the pleura covering it. Now how actually this mediastinum develops is, you all know that the esophagus is nothing but a part of foregut. It is also a gut tube, primitive gut tube. This gut has to be suspended from the body wall. You should not go and touch the anterior body wall, or it should not go and get approximated to the posterior body wall. It has to be suspended in the midline. So thereby you have a fold from the esophagus to the anterior body wall, which is called as the mesoesophagus, anterior mesoesophagus. Same way posteriorly you have the posterior mesoesophagus. So the structures, finally what you see in the mediastinum, actually develop into this anterior and posterior mesoesophagus. Okay, that is one thing. Then when you look at the mediastinal structures, how they are actually disposed, all the major veins you see are on to the right side. Okay, your superior vena cava, your azygos vein, okay, are all present to the right side. And you all know the venous walls are not very thick, they are very thin and offers little resistance. So thereby any growth, mediastinal growth, tends to actually move towards the right side because of this reason. Okay, so that is what I told you. Most of the veins are on the right side, whereas the major arteries are actually concentrated onto the left side. And development of the mediastinum, as I told you, it is from the ventral and dorsal mesoesophagus. So now, with this general consideration of what is mediastinum and what are the major subdivisions of the mediastinum, and we have seen the whole mediastinum as a whole and the boundaries of it. Now we will come to the superior mediastinum. Superior mediastinum. Well, what will be the boundaries of the superior mediastinum? So anteriorly it is going to be the manubrium sterni, and posteriorly it is the first, second, third and fourth thoracic vertebra with their intervertebral discs. Okay. So behind T1 to T4 vertebra with the intervertebral disc, and in front of the vertebra, body of the vertebra, you have the anterior longitudinal ligament. You have the anterior longitudinal ligament. Okay. So that will be the posterior boundary. In front and behind, and the sides, always it is going to be the mediastinal pleura. Okay. Sides, it is always going to be the mediastinal pleura, and above it is the thoracic inlet, which is bounded by the upper border of manubrium sterni, inner border of the first rib, and the anterior surface of T1 vertebra posteriorly. So above it is going to be the thoracic inlet, and below it is the imaginary plane passing through the sternal angle in front to the lower border of the fourth thoracic vertebra. So these are the boundaries of the superior mediastinum. Okay. So in front manubrium sterni, behind upper four thoracic vertebra, and on each sides, either sides, it is going to be the mediastinal pleura. Now let us enumerate the contents, how the contents are present in the mediastinum. The contents, again, for the sake of our understanding, the contents can be divided into three layers. They are actually present in the form of three layers. Immediately behind the sternum, those anterior most structures, they are called as retrosternal because they are present just behind the sternum. Then the structures which are in the middle, we call it as intermediate structures, and more posterior one, we call it as prevertebral structures because it is present in front of the vertebra. So from anterior to posterior, it is retrosternal, intermediate, and then prevertebral structures. Now, in the retrosternal part, immediately behind the sternum, you have two muscles originating from the manubrium sternum, which is the sternothyroid and the sternohyoid. Okay. So origin of sternothyroid and sternohyoid, and immediately behind that, what you are able to see is the thymus gland. So it is a roughly bilobed gland, most active in the fetal life, and then slowly after first year of age, what happens? It is replaced by fatty tissue. So one of the primary lymphoid organ which is responsible for the production of the T lymphocytes. Okay, it is replaced by fat. So thymus gland you come across in the retrosternal part. So origin of sternothyroid, sternohyoid, and the thymus gland forms the retrosternal part of the superior mediastinum. So that is the thymus gland for you. Then coming to the intermediate structures. So that is how, now remove the retrosternal structures, you are able to see the intermediate structures. It is mostly what you are able to see is the veins. Okay. So the veins you come across are the intermediate structures. The major veins you come across. Okay. Now, before that, sorry, there is just a small correction I would like to make. The veins don't fall under the intermediate structures. They are actually retrosternal only, because you know very well that the veins offer a little resistance. So if it is present in between or posterior, naturally it might get compressed, and it might result in impedance of venous return. So the venous return might get affected. So because of that, even veins has to be present anteriorly. So you have the right brachiocephalic and the left brachiocephalic vein and upper part of the superior vena cava, because both the brachiocephalic vein forms the superior vena cava. Okay, so retrosternal is your origin of the two muscles I told you, Thymus Gland and the right and left brachiocephalic vein and upper part of superior vena cava. So next you come across is the intermediate structures, mainly the arteries. You see the major arteries and some of the nerves along with it, and these two tubes mainly form the prevertebral structures, most posterior part. Coming to the intermediate structures, definitely it is going to be the major vessels are nothing but the branches of the arch of aorta. Okay. So aorta and its branches, mainly the three branches are the right brachiocephalic, then you have the left common carotid and the left subclavian artery. So along with that you will have the phrenic nerve and the pericardiophrenic vessels. So it will be present between the mediastinal pleura and the intermediate structures, phrenic nerve and the pericardiophrenic vessels. Then vagus nerve and the cardiac nerves. So that is the sympathetic branches from the sympathetic chain and the parasympathetic branches from the vagus. They form the cardiac nerves. So intermediate is arch of aorta with its branches, then along with it phrenic and vagus nerve. Now prevertebral structures. So we have removed the retrosternal structures and then we remove the intermediate structures. Posterior most what you see here is the prevertebral structures. So the arch of aorta has been removed along with its branches. You come across trachea. Behind the trachea what you see is the esophagus. Trachea and esophagus are the two important structures which you come across. In the groove between the trachea and the esophagus, you see the left recurrent laryngeal nerve. Okay. Actually, the left recurrent laryngeal nerve winds around the arch of aorta. Okay. You might ask why there is no right recurrent laryngeal nerve. Right recurrent laryngeal nerve actually winds around at the upper level itself. It is not seen at this lower level. Okay. So it actually winds around the subclavian artery of the right side, right subclavian artery. So prevertebral you come across trachea, esophagus, left recurrent laryngeal nerve. Then what you see, you don't see here is the azygos vein. You are able to see only the termination of azygos vein. That is the arch which will go and terminate into the superior vena cava. Okay. Superior vena cava. So this is actually your, on either side you see the mediastinal surface of pleura with a lung, and most posteriorly behind that you will see the muscles in front of the vertebra. So in the neck and in the upper part of the thorax what you have is the longus colli muscle which originates. They are actually called as prevertebral muscles. So remember, anteriorly mainly you should remember the venous structures are present, the major veins, brachiocephalic vein of both sides and the superior vena cava. Intermediate mainly you have the arch of aorta and its branches. Posteriorly you have these two major tubes, that is the trachea and the esophagus, with the recurrent laryngeal nerve of the left side seen in the groove between them. Okay. Then you have the azygos vein and the thoracic duct, the largest lymphatic trunk. The largest lymphatic trunk which will be seen again on the left side. So here you are able to see this green color structure, that is actually the thoracic duct. Actually it has crossed from right side to the left side at the level of the sternal angle. So that is the thoracic duct for you. So we have finished about enumerating the structures of the superior mediastinum. So now I will pass on to the inferior mediastinum. So as I have already mentioned, The inferior mediastinum is again subdivided into anterior, middle and posterior mediastinum. So anterior mediastinum present in front of the fibrous pericardium. So present in front of the fibrous pericardium, very narrow space and no important structures are actually present. Okay. So front of pericardium and behind the body of sternum. It is below the fourth costal cartilage. What happens is it is somewhat wider. Above the fourth costal cartilage, what happens is both the lungs with the pleura are in close approximation. Okay, so there it is very narrow, and slowly as you come below the fourth costal cartilage only, what happens is the anterior mediastinum is wide due to the deviation of pleura, especially the left lung pleura deviates to form the cardiac notch. So contents, mainly it is going to have no important structures. Sternopericardial ligaments, superior and inferior sternopericardial ligaments, which attaches from the pericardium to your sternum. Okay, so mainly you will have that. Then you will have some mediastinal lymph nodes. You will have mediastinal lymph nodes or retrosternal. Then internal thoracic artery, branches of internal thoracic artery, and some loose areolar tissue. So you can understand there is not much any important or vital structure which is present in the anterior mediastinum. Sternopericardial ligaments and mediastinal branches of the internal thoracic artery are present in this anterior mediastinum. Next, coming to the behind the anterior mediastinum, you see this middle mediastinum. So middle mediastinum mainly consists of heart with the fibrous pericardium. It is the widest subdivision. It is the widest subdivision, and you are able to see the view of both the sides. This is view of the middle mediastinum from the right side. This is view of the middle mediastinum from the left side. Mediastinal structures, that is the right view, and this is the left view. So mainly it consists of heart with the fibrous pericardium. Then what else you have? The major vessels which are entering and leaving the heart. So leaving the heart, pulmonary trunk. Okay, so you are able to see this is actually the pulmonary trunk dividing into right and left pulmonary artery. Then you will be able to see the ascending aorta. So that is actually the ascending aorta. Pulmonary trunk dividing into right and left pulmonary arteries, either sides. Ascending aorta mostly seen onto the left side. Okay. 4 pulmonary veins you are able to see here, which is going to reach the left atrium. Termination of 4 pulmonary veins. Then lower part of superior vena cava. Then you see the bifurcation of trachea. So left side mainly you are able to see the left principal bronchus here. So apart from the heart and the fibrous pericardium, so mainly pulmonary artery, pulmonary vein and trachea, these are all you can remember very easily because they form the lung root structures. We have already discussed about this lung root structures, how they enter the hilum and how actually they are present. That order also we have discussed in detail in the lung class, from above downwards and from before backwards. So again I will repeat: fibrous pericardium, heart with its fibrous pericardium, then great vessels attached to the heart, pulmonary trunk dividing into right and left pulmonary artery, ascending aorta, termination of 4 pulmonary veins, termination of SVC, and then bifurcation of trachea. So these are the structures which are actually present in the middle mediastinum. Next we will pass on to the inferior mediastinum. Okay. So before that you are also able to see this is the phrenic nerve with the pericardiophrenik vessels, which is going to pierce the diaphragm. Phrenic nerve and the pericardiophrenik vessels. So posterior mediastinum. So here we have seen about the superior mediastinum, retrosternal, intermediate, and then prevertebral structures. In the inferior mediastinum, just now we have seen about the middle mediastinum with the heart with the fibrous pericardium, pulmonary trunk actually dividing this one, pulmonary trunk, and this is your aorta, termination of pulmonary veins and bifurcation of trachea. Okay. Posterior mediastinum is actually this part. Now what are the boundaries of the posterior mediastinum? In front you have the bifurcation of the trachea. Then you have the posterior surface of the pericardium and then posterior sloping surface of the diaphragm. Posterior sloping surface. They all form the anterior boundary. Posteriorly, you know very well, it is going to be limited by the lower 8 thoracic vertebra. Behind, it is going to be the bodies of lower 8 thoracic vertebra and intervening intervertebral discs. Okay, lower 8 thoracic vertebra and intervertebral discs. So here you are able to see. So that is the anterior in front, anterior border of or the anterior wall of the inferior mediastinum. Bifurcation of trachea, fibrous pericardium posterior surface and posterior sloping surface of the diaphragm. Below the imaginary plane, it is the lower 8 thoracic vertebra, bodies of lower 8 thoracic vertebra and the intervening intervertebral discs. So above it is the imaginary plane and below it is going to be the diaphragm. So these are the boundaries of the inferior mediastinum. Okay, and as I told you, it is going to be the mediastinal pleura. So mediastinal pleura on each side is a constant structure, either it is for the superior or it is for the inferior mediastinum, and in the inferior whether it is anterior, middle or posterior mediastinum. Now the structures, we can appreciate the structures in the inferior mediastinum. You have longitudinal structures. Okay, so vertically they are disposed, and certain structures are also present transversely in the posterior mediastinum. So longitudinal structures, from this picture itself you can very well understand it is the descending thoracic aorta and the esophagus. Mainly you see the descending thoracic aorta and the esophagus. Then this is your arch of azygos vein. So before that you would have seen the azygos vein here. Okay, so azygos vein. Then you are able to see this thoracic duct. It is actually present behind the esophagus. So that is actually the thoracic duct. So these are the 4 main longitudinal structures. Okay, esophagus, descending thoracic aorta, azygos vein, as I told you, thoracic duct. Hemiazygos vein will be onto the left side. It is the lower counterpart of the azygos vein, lower half of the counterpart of the azygos vein onto the left side. These are the vertical structures or longitudinal structures which are present here. Okay, then the transverse structures. So the transverse structures. So before that, you are also appreciating some nodes. These are actually called as the tracheobronchial lymph nodes. And here on either side you will have the paratracheal lymph nodes. This is tracheobronchial lymph nodes. Okay. What I have not mentioned is the vagus nerve and the splanchnic nerves. Splanchnic nerves are again sympathetic nerves. You have greater, lesser and least splanchnic nerves. So about vagus and splanchnic nerves we will be discussing separately in the autonomic nervous system of the thorax. Now coming to the transverse structures. So mainly you see the posterior intercostal veins and posterior intercostal arteries. Posterior intercostal arteries. Then, okay, longitudinal structures, azygos vein. Last, it was not there in the last picture. Now you are able to see the azygos vein. Now once the esophagus is removed, you are able to see the thoracic duct. You are able to see the thoracic duct. Thoracic duct at the level of the sternal angle will cross from the right side to the left side. So that is why on the superior mediastinum you would have seen the thoracic duct on the left side. Okay. So transverse structures, posterior intercostal vessels, as I told you. Then the azygos vein, I told you, on the left side will turn or run transversely to end in the azygos vein. Hemiazygos vein. Same way upper half you have the accessory hemiazygos vein, they also will terminate. So mainly the termination of accessory hemiazygos vein and hemiazygos vein. Then posterior intercostal vessels, as I told you, and then deviation of the thoracic duct from the right side to the left side. So these are the transverse structures of the inferior mediastinum. Okay, so that is about the structures of the transverse and the longitudinal structures of the inferior mediastinum. So far we have discussed about the definition and extent of mediastinum as a whole. Then we have discussed about how the whole of the mediastinum is divided into superior and inferior mediastinum. Then we have discussed about the boundaries, extent and content of the superior mediastinum. Then inferior mediastinum also we have discussed about the boundaries of anterior, middle and posterior mediastinum and contents of each of these subdivisions. So now I will discuss about mainly two contents, that is the arch of aorta and superior vena cava, which is present in the superior mediastinum, and then a brief description about the trachea. Now, if you look at the arch of aorta, you all know that it is actually a continuation of the ascending aorta, and then the arch of aorta continues downwards as the descending thoracic aorta. The arch of aorta is a content of superior mediastinum. It is an intermediate structure which is present immediately behind the veins and anterior to the prevertebral structures. Okay, it ends and begins. It begins and ends at the same level, that is at the sternal angle or T4 vertebra. Okay, T4 vertebra, it begins and starts and ends at the same level. So from the right chondrosternal junction to the left chondrosternal junction is its extension, okay, or the lateral limit. The lateral limit is from the right chondrosternal junction to the left chondrosternal junction. It is arching over the root of the left lung. So because of that, the lower part of the trachea is also displaced slightly towards the left side. Okay, slightly, not towards the left side, to the right side, slightly towards the right side, because of the pressure given by the arch of aorta. Okay. So behind the manubrium sternum, the arch of aorta is actually present. Now, it first runs upwards, backwards and towards the right side. Okay. So first it runs upwards, backwards and towards the right side. Okay. Upwards, backwards and towards the to the left side, and then what happens is backwards to the left of trachea and finally turn downwards. Finally turn downwards to continue as the descending thoracic aorta. It shows two convexities. One convexity is anteriorly and other convexity superiorly or above, while it is arching over the root of the left lung. Then near its commencement it shows a dilatation. It is called as the aortic bulb. At its commencement it shows a dilatation which is actually called as the aortic bulb. Okay. So arch of aorta begins and ends at the same level, T4, lower border of the T4 vertebra. It is present behind the manubrium sternum. Okay. So the relations of the arch of aorta, you can divide it into, since it is somewhat obliquely oriented. Okay. First it runs upwards, backwards and towards the left side, and then upwards, then backwards and finally downwards. The relations are anteriorly and towards the left, posteriorly and towards the right. Anteriorly towards the left and posteriorly towards the right. So that is how the relations or the structures are disposed. So anteriorly and to the left, mainly you have four nerves. Okay. Mainly you have the four nerves. This is anteriorly and towards the right, towards the left you have four nerves. So mainly these nerves are the phrenic nerve, superior cervical cardiac branch and inferior cervical cardiac branch. Okay. So you have the left phrenic nerve, superior cervical and inferior cervical cardiac branch. So here you are able to see the phrenic nerve is somewhat crossing. Okay, so that is the phrenic nerve. Then inferior cervical cardiac branch will be from the vagus. Inferior cervical is actually a branch of vagus which is going to take part in the cardiac plexus. And then superior cervical cardiac branch will be from the sympathetic chain, superior cervical cardiac branch. And then one more branch of the vagus is the left recurrent laryngeal nerve. So it will wind around the arch of aorta, and then you are able to see here in the tracheo-esophageal loop. So anteriorly, since it is winding, it also forms a anterior relation. Okay. So four nerves, left phrenic nerve, then superior cervical cardiac branch, inferior cervical cardiac branch of left vagus, left recurrent laryngeal nerve. Apart from that, you also have the left superior intercostal vein which will cross like this. It has been removed. You are able to see only the place where it is terminating into the left brachiocephalic. So one more structure anteriorly is the left superior intercostal vein. Okay. Now coming to the relations posteriorly and to the right. Okay. So these are the relations which is behind the aorta, posteriorly and to the right. So very well you know, mainly these two tubes are going to form the trachea and the esophagus. And what I told you, in the groove between the trachea and the esophagus, left recurrent laryngeal nerve. Okay. And then deep cardiac plexus, which will be present near the bifurcation of the trachea. And then more posteriorly what you see is the fourth thoracic vertebra. Okay. So you are able to see a superior view of the mediastinum. The arch of aorta is being cut. Okay, the arch of aorta. Posteriorly and to the right you see the trachea, esophagus. In the groove between these two you should see the left recurrent laryngeal nerve. Okay. This is the body of fourth thoracic vertebra. Okay. Fourth thoracic vertebra. So posterior and to the right, more upper part, since you see also a part of the superior vena cava as you come little above. Okay. The other posterior part of the intercostal spaces, you are able to see the posterior intercostal arteries. I am just explaining, this is not related to the aorta. Sympathetic chain, you are able to see the sympathetic chain. This is actually the superior intercostal vein. Okay. So that is about the relations posteriorly and to the right. Mainly remember this trachea, esophagus and recurrent laryngeal nerve and fourth thoracic vertebra. Superior relations, very easy superior relation to remember. It is simply the branches of aorta. Okay. So right brachiocephalic, left common carotid, left subclavian. So all these are actually crossed by the brachiocephalic vein, that is the left brachiocephalic vein. Okay, three branches and all are crossed by the left brachiocephalic vein. They form the superior relations. Inferior relations below, what you see here is the left principal bronchus. You see the left principal bronchus. So, and then bifurcation of the pulmonary trunk, left principal bronchus and bifurcation of the pulmonary trunk. Then you see superficial cardiac plexus, it is just present near the pulmonary trunk, and then ligamentum arteriosum and left recurrent laryngeal nerve. So, anterior relation, left recurrent laryngeal nerve, you are able to see here, and then it is winding in the tracheo-esophageal groove, so thereby it also forms the inferior relation, and it is also going to form the one of the posterior relations and to the right. So left recurrent laryngeal nerve is related to the arch of aorta anteriorly, inferiorly and also posteriorly. Okay, so here you are able to see cervical cardiac branches from the sympathetic trunk, as I told you. Okay, so mainly you see the bifurcation of the trachea, the left principal bronchus, pulmonary trunk. Here you have the superficial cardiac plexus. Then one more structure is the ligamentum arteriosum. So here you are able to see this ligamentum arteriosum. It is actually fibrosed. It has become a ligament, but in fetal life it is actually called as a ductus arteriosus, which will be shunting the blood from the pulmonary trunk to the aorta. So it is actually diverting the blood from the pulmonary trunk to aorta because the lungs are not functional in the fetal life. Okay, but what happens is it should get fibrosed, called as the ligamentum arteriosum. So branches of arch of aorta are mainly right brachiocephalic trunk, left common carotid and left subclavian artery. You also have occasional branches like arteria thyroidea ema. Sometimes your left vertebral artery will arise from the arch of aorta. These are all not normal branches. Sometimes your internal thoracic artery, okay, and bronchial artery, left bronchial artery might arise. So these are the branches, right brachiocephalic dividing into right common carotid and right subclavian. This is left common carotid and left subclavian artery. Now, the arch of aorta, how it actually develops from the truncus arteriosus. You are able to see from the truncus arteriosus, it develops from three sources. Then fourth aortic arch artery. Okay, there are series of arterial arches, 6 arches. Fifth one does not actually develop at all. The remaining one, first, second, third, fourth and sixth gives rise to so many structures. So I am not going to discuss in detail about this development of arterial arches. I will just touch upon the development of aorta in brief. So from the horn of the aortic sac, left horn and right horn you have. From the left horn of the aortic sac, and then from the left fourth aortic arch artery. This is connecting the horn of the aortic sac with the dorsal aorta. So left to fourth arch artery, and then followed by that finally it is the dorsal aorta, left part of the dorsal aorta. So 1, 2 and 3 all contributes to the formation of the arch of aorta. 3 sources you just remember. Left horn of the aortic sac, left fourth aortic arch artery, and finally the left part of the dorsal aorta. Okay. So aortic aneurysm is abnormal dilatation. Abnormal dilatation is actually called as aortic aneurysm, and it might occur anywhere, even in the descending thoracic aorta, not only in the arch of aorta. Okay. Next is actually aortic dissection. You are able to see, due to aneurysms, what happens is the wall of the aorta might get torn. So you are able to see the wall is actually getting separated, and that is actually called as the aortic dissection. There is a tear in the wall of aorta. Then coarctation of aorta. So coarctation of aorta is actually abnormal narrowing. You are able to see the aorta is getting narrow. It might be preductal or postductal. Preductal or postductal means this is ductus arteriosus, which in the adult life is called as, I told you, the ligamentum arteriosum. So like that, if it is going to be preductal, the coarctation is going to be before the duct, then this ductus arteriosus will be patent in adult life. Okay, then you call it as patent ductus arteriosus. Sometimes why you see a right-sided aorta is because last slide we have seen the dorsal aorta. If the right-sided dorsal aorta is persistent, instead of left persistent, left disappears, and if the right-sided dorsal aorta is persistent, then the arch of aorta will be formed on the right side. Okay, that is called as a right-sided aorta. So that is actually the patent ductus arteriosus. There is a communication between the pulmonary trunk and the arch of aorta. So definitely there will be mixing of oxygenated and deoxygenated blood. Sometimes you see double aortic arch. Okay. Double aortic arch is because the dorsal aorta is persistent, and left, instead of left, the right fourth arch artery also, if it is present, it will give rise to the double aortic arch. So next, coming to the superior vena cava. So it drains blood from the upper half of your body, okay, head, neck and the upper limb, and also from the thorax above the diaphragm. So all the venous blood above the diaphragm is actually drained by the superior vena cava. The superior vena cava terminates into your right atrium, and it is formed by the union of the right and left brachiocephalic veins. Okay. So it is a content of superior mediastinum, the upper part, and the lower part is actually in the middle mediastinum after piercing the fibrous pericardium. So after piercing, so the imaginary line here shows that this part, upper part of the SVC, is in the superior mediastinum. The lower part, where it is going to terminate into the right atrium, is in the inferior mediastinum. For the lower part, it will pierce the fibrous pericardium and then open or terminate into the right atrium. So its extent is actually from the right first costal cartilage to the right third costal cartilage. So after it is united by the formation of the right and left brachiocephalic vein. Okay. So from first costal cartilage to the third, at the level of second costal cartilage, it pierces the diaphragm and enters the middle mediastinum. Okay. So first costal cartilage, where it is formed, second costal cartilage, where it pierces the fibrous pericardium, third costal cartilage, where it terminates, that is the end of SVC, into the right atrium. Okay. So opens into the right atrium at the level of third costal cartilage. So you remember first, second and third costal cartilage. So relations of the superior vena cava. In front, it is going to related to the anterior border or right lung and pleura. And since it is piercing the pericardium at the level of second costal cartilage, that also forms the anterior relation. In front of the lung, you will have the intercostal spaces, especially the first, second intercostal spaces with the intercostal muscles, and then internal thoracic artery anteriorly. Okay. Then lower part, it will be related to the root of the lung. So right lung root, it will be related to the root of the right lung behind, posterior relations. In the upper part, it will be related to the trachea, right vagus nerve, and also the right lung. Okay. So anteriorly, it is the right lung and the pleura. To the right side, again it is related to the right lung and pleura. Left side, brachiocephalic trunk. The brachiocephalic trunk and the common carotid artery will be first related to it. And then what happens is, it is related to the left side of the superior vena cava. Okay. Posteriorly to the trachea, vagus nerve and the root structures, the root of the right lung. So anteriorly, the anterior margin of the right lung and pleura and first two intercostal spaces and the fibrous pericardium in the lower part. Posteriorly, it is related to the trachea and the root of the right lung. Okay. So here you are able to see the formation of the superior vena cava and the tributaries. So formative tributaries are the right and left brachiocephalic vein. Right and left brachiocephalic vein. Then azygos vein will come and enter just before piercing the fibrous pericardium. Termination of azygos vein. Then apart from that, you have some pericardial and mediastinal veins. Pericardial and mediastinal veins. So sometimes you also have a double superior vena cava. Okay, double superior vena cava, because superior vena cava develops from anterior cardiac vein and the communication between this one superior cardiac veins of the either side. Okay, so sometimes you also have a left-sided superior vena cava. Next, in short about the trachea. So it is a cartilaginous tube and posteriorly represented by membrane and trachealis muscle from the sixth cervical vertebra. It starts in the neck. C6 is the starting point for the trachea as well as the esophagus, and at the level of fourth thoracic vertebra, it bifurcates into the right and left principal bronchus. It divides into right and left principal bronchus. In the neck region, the relations anteriorly, it will be related the skin, superficial fascia, deep cervical fascia, and then in front of the trachea, pretracheal fascia. Okay, and then opposite the third, fourth, and fifth tracheal ring, you have the isthmus of the thyroid gland. Inferior thyroid vein, which is actually emerging, and then you have the anastomosis of the superior thyroid artery. These are the anterior relations. Mainly remember the isthmus of the thyroid gland. On either side, you have the lateral lobes of the thyroid gland. Posteriorly, it is related to the esophagus and the recurrent laryngeal nerve in the tracheoesophageal groove. Okay, so on either side you have the lateral lobe of the thyroid, and then the structures in the carotid sheath, mainly your common carotid and inferior thyroid artery, which is a branch of the thyrocervical trunk, which will actually coming from the below is the thyrocervical trunk. So as I told you, isthmus opposite the second, third and the fourth tracheal ring. Okay. So relations of the trachea in the thorax. So these are the relations of the trachea. To the right side, right lung, pleura and arch of azygous vein. The azygous vein will be arch of azygous vein. You will be able to see here. To the left side, you also see the arch of aorta, and the arch of aorta displaces the trachea slightly towards the right side. So on the left side, you see the arch of aorta, and then common carotid artery and brachiocephalic, they are somewhat anterior, but as they move upwards, they move to the respective right side and the left side in a hemispherical fashion. Right and left side in the hemispherical fashion. Okay. So behind you have the esophagus and recurrent laryngeal nerve, which I have already told you. So these are the structures. So just remember that in the thorax, we have to remember how the structures are disposed in the superior mediastinum, the retrosternal and the intermediate structures. So those things actually are formed here, which forms the anterior relation of the trachea in the thorax. So as I told you, brachiocephalic vein to the front, arch of aorta near its bifurcation, and brachiocephalic and common carotid arteries. So they all form the anterior relations, which is nothing but your structures in the superior mediastinum. So inferior thyroid artery and the bronchial arteries, they supply, and inferior thyroid veins is the venous drainage. You have the paratracheal nodes, and in front of the trachea you have the pretracheal nodes, which are responsible for the venous drainage of the trachea. The internal diameter of newborn is just 3 millimeter, and it increases at 0.1 millimeter at every year up to 12 years. Okay. And not only that, since it is at a higher level, at T3 level it might bifurcate. So the arch of aorta and the left brachiocephalic vein also might be at a higher level. So in children it is very risky to do low tracheostomy. In adults we prefer low tracheostomy so that we don't disturb the thyroid gland, isthmus of thyroid gland. So we go a bit lower. But in children it is very risky to do low tracheostomy because the trachea is slightly at a higher level and still it has not come to its original position. Okay. In adult it is okay because only at the T4 level you see the arch of aorta and bifurcation of the trachea, and the internal diameter is actually 12 millimeters, which is 3 times more than the newborn. So tracheostomy is actually a emergency procedure where actually the person cannot breathe on his own, or if there is an obstruction, okay, especially if the larynx is obstructed, if there is a laryngeal edema, and naturally what happens is you have to do a tracheostomy. In adults, low tracheostomy is actually done to create an airway, to actually create an external airway so that air enters into the lungs. And in patients who cannot breathe, then naturally what you do is endotracheal intubation. So insert a tube and that is actually connected to a ventilator. So persons who are very terminally ill, who cannot breathe, or who are comatose patients, what happens is, what you do is endotracheal intubation. So insert a tube after creating a tracheostomy. Okay, tracheostomy is nothing but creating an opening in the trachea, thereby you create a airway, external airway, and then you insert a tube, endotracheal intubation, and through that it can be connected to a ventilator. So any infections of the mediastinum is actually called as mediastinitis. It may come from pretracheal and prevertebral fascia, and it may track down into your superior mediastinum, or sometimes perforation of the esophagus. If the esophagus is eroded due to esophagitis, in extreme cases the posterior wall of the esophagus might get perforated and bleeding might take place, and that also might enter into the superior mediastinum or to the posterior mediastinum. Sometimes mediastinitis, it might due to chronic fibrosis, mediastinitis, the structures adhesions might take place and fibrose due to involvement of the lymph nodes, and this is chronic, that is for prolonged infections of the mediastinum. So here you are able to see a sagittal section of the neck. So this is the esophagus and trachea. In front of the trachea, what you see is the pretracheal fascia, and here you are able to see in front of the prevertebral muscles, and that is the prevertebral fascia. So behind the esophagus and pharynx, you have the retropharyngeal space. Now the pretracheal fascia attaches to the fibrous pericardium of the heart. So any infections can track down from here to the superior mediastinum. Same way here, what you see here is the prevertebral fascia from the retropharyngeal space behind the pharynx. The infections can again track down to the superior, and then it can go to the inferior mediastinum. So that is why it is labeled as the danger zone here. Not only that, any tuberculosis, cold abscess from the vertebra also can enter into this space, and naturally it can track down. So this is some of the applied aspects. So thank you very much for your patient listening. We will meet again in one more session.